Pharmacology. 30 NCLEX-style questions with rationales. Question 1. A patient on furosemide should be monitored for which electrolyte imbalance? A. Hypernatremia, B. Hyperkalemia, C. Hypokalemia, D. Hypercalcemia. Question 2. A patient taking lisinopril reports lip swelling and difficulty breathing. What is the priority action? A. Administer diphenhydramine. B. Stop the medication and notify provider immediately. C. Check blood pressure. D. Give epinephrine IM. Question 3. A postpartum patient receiving oxytocin develops uterine tachycystole. What should the nurse do first? A. Increase IV fluids. B. Stop oxytocin infusion. C. Administer magnesium sulfate. D. Check temperature. Question 4. A patient on lithium has a level of 1.8 milliequivalent per liter. What should the nurse do? A. Administer next dose. B. Encourage fluids. C. Hold medication and notify provider. D. Restrict sodium. Question 5. Which finding indicates digoxin toxicity? A. Hypertension, B. Yellow halos. C. Hyperactivity, D. bradycardia absent. Question 6. A patient receiving heparin has a PTT 120 seconds. What is priority? A. Give vitamin K. Stop infusion. C. Administer protamine sulfate. D. Increase dose. Question 7. Methotrexate for ectopic pregnancy requires monitoring of A. HGB-HCG levels. C. Platelets, D. WBC. Question 8. A patient on warfarin should avoid A. Bananas, B. Spinach, C. Milk, D. Rice. Question 9. A patient taking haloperidol develops neck stiffness and tongue protrusion. What is this? A. Tardive dyskinesia. B. NMSC dystonia, D. akathisia. Question 10. Magnesium sulfate toxicity is indicated by A. BP 150/90ths. B. Absent DTRs circa or 110 DRR18. Question 11. Which medication is contraindicated in pregnancy? A. Penicillin, B. Acetaminophen, C. Isotretinoin, D. Cephalexin. Question 12. A patient on insulin glargine should A. Mix with regular insulin. B. Take before meals. C. Not mix with other insulins. D. Hold if Bg less than 250. Question 13. Clozapine requires monitoring for A. Hyperkalemia, B. Agranulocytosis, C. Hyperglycemia, D. Hypocalcemia. Question 14. A patient on metformin is scheduled for CT with contrast. What should nurse do? A. Give extra dose. B. Hold 24 to 48 hours before and after. C. Check potassium. D. Increase fluids only. Question 15. Sertraline increases risk of A. Hypotension, B. Serotonin syndrome, C. Hypoglycemia, D. Agranulocytosis. Question 16. Protamine sulfate reverses A. Warfarin, B. heparin, C. Lovenox, D. aspirin. Question 17. Which medication requires trough levels? A. Vancomycin, B. acetaminophen, C. prednisone, D. ibuprofen. Question 18. Nifedipine in preterm labor works by A. Increasing contractions, B. Relaxing uterine smooth muscle, C. Increasing BPD, stimulating oxytocin. Question 19. A patient on prednisone should be monitored for A. Hypoglycemia, B. hyperglycemia, C. bradycardia, D. hyponatremia. Question 20. Which lab indicates heparin-induced thrombocytopenia? A. Elevated INRB platelets less than 100,000, C. Elevated WBC, D. Elevated K. Question 21. Naloxone reverses A. Opioids, B. Benzodiazepines, C. SSRIs, D. barbiturates. Question 22. Flamazanil reverses A. Benzodiazepines, B. Morphine, C. Fentanyl, D. methadone. Question 23. Terbutaline side effect A. bradycardia, B. seizures, C. hypotension, D. tachycardia. Question 24. Which med causes cough? A. Lisinopril, B. Losartan, C. amlodipine, D. metoprolol. Question 25. Phenytoin toxicity sign A. Hair loss, B. Gingival hyperplasia, C. Jaundice, D. edema. Question 26. Isoniazid requires A. Vitamin C, B. Vitamin B6, C. Iron, D. Vitamin D. Question 27. A patient on morphine should be monitored for A. Respiratory rate less than 12, B. BP greater than 150, C. Heart rate greater than 100, D. Temp 99 Fahrenheit. Question 28. Which med treats eclampsia? A. Oxytocin, B. Magnesium sulfate, C. Terbutaline, D. labetalol. Question 29. Warfarin therapeutic INR A. 0.8 to 1, B. 1 to 1.5, C. 2 to 3, D. 4 to 5. Question 30. Albuterol side effect A. bradycardia, B. tremors, C. constipation, D. hypoglycemia.